In the video where we talked about having a show or the mucus plug, we talked about the changes the cervix makes to prepare for birth, and that process is called effacement. We're now going to talk a little bit more about the effacement process and actually how your body prepares to birth your baby. So I've got a little balloon here that's going to represent the uterus, and this bit coming down from the balloon is going to represent the cervix or the neck of the womb. So remember, the cervix is tucked backwards in pregnancy and about 4 to 5 centimeters in length, thick and tubular, and in that little tube sits the show. It might be as you're getting into your 3rd trimester of pregnancy that you start to experience some Braxton hicks contractions. And these are your body's practice contractions of preparing the uterine muscle for birth. Some ladies may not feel any Braxton hicks, other ladies may feel quite a few. It's a period where you feel your tummy tighten, perhaps for a couple of seconds or even longer and for a couple of minutes, and then it relaxes again. Braxton hicks contractions are usually not uncomfortable, but some ladies do find they are a little uncomfy. So the advice would be to listen to your body and to rest if actually resting felt more comfortable, or if being more active helps, then to be active and move around. So the Braxton hicks contractions are the practice contractions for birth. And what I'm going to show you is actually how these have very little effect on the cervix or the neck of the womb. So the Braxton hicks contractions are going to gently cause the uterus to contract and to relax. And hopefully you can see there that that is actually having no effect on the length of the cervix. And as I turn the balloon this way, you can see that actually this is as dilated or as open as the cervix is going to be, whilst the cervix has got this length to it. As your body practices and prepares the uterus for birth, then the contractions will start to come in a more regular pattern as your baby is ready to birth. And this is how you can differentiate between Braxton hicks and a labour contraction. Labour contractions can start quite infrequently, so perhaps every 10 to 15 minutes, lasting 20 to 30 seconds. And then they don't go away, they carry on coming more regularly with a shorter interval, and they begin to last a bit longer and begin to last perhaps 30 to 40 seconds or 50 to 60 seconds. And it's looking for this change or pattern that tells you that this is likely labour and not just the practice Braxton hicks contractions. I'm going to talk to you a little bit about the contraction pattern and how our body births our baby. We talk about the different stages of the birth process as being a continuum, and everyone will experience this differently. The very early start of labour is what I like to refer to as the piece of string. And the reason for calling it this is that a piece of string will be various lengths for each lady. Some ladies might have a short piece of string in a matter of a few hours. Other ladies may have a much longer piece of string and feel that build-up of contractions in quite an irregular pattern for many hours. Often ladies who share their birth stories and say that their labour was 24 hours, 36 hours, 3 days. Those ladies likely experienced a really long piece of string, and that early phase took some time. We'll talk in further videos about what we can do to keep calm and relaxed during this point. What I'm going to show you is that until the piece of string bit is completed, then the body or the uterus can't labour more efficiently. With our first babies, because our uterus has never worked in this way before, the cervix has to thin and soften and shorten and efface before it can begin to open or dilate more efficiently. So from losing all of its length, coming forward, nice and thin, and opening or dilating to around 4 centimeters is the piece of string part. So we can understand that actually our body is doing a lot of work in that time. Once the cervix has fully effaced and opened or dilated to around 4 centimeters of dilatation, then the process happens with a little bit more speed. And typically you would have 6 to 12 hours of more regular contractions to take the cervix to full dilatation, or 10 centimeters. And this is the point where the baby has a clear path to be birthed. Some ladies take a little bit more time than this, and other ladies do it a little bit quicker. But generally your body will work at the pace that's right for you and your baby. I will now demonstrate how the piece of string process works. And actually with our first baby in particular, until the cervix has lost all of its length and thinned and softened and shortened and opened or dilated to around 4 centimeters, then that is the point where labour begins a little bit more actively, and the cervix can then open or dilate a little bit more efficiently. So hopefully you'll be able to see this process. So during your baby's birth, the midwife will ask if she can just gently pop a hand at the top of your tummy, and what we can feel is the uterus to tighten and relax, with the contractions. By gently feeling, the midwife can assess how frequently your contractions are coming, how long they are lasting, and how strong do they feel. Hopefully what you will be able to see with this little demonstration is that whilst the cervix has length to it and is still in that piece of string process, the cervix cannot open or dilate anymore. Once the cervix has fully effaced, come forward, lost all of its length, thinned, softened, and opened or dilated to around 4 centimeters, the cervix can then dilate more efficiently with the contractions. It's really important to understand this because with our first baby, this process must happen. And typically what happens is when you hopefully come back and have another baby with us, because the cervix and the uterine muscle has worked in this way before, it has a little bit of what we call muscle memory, and then it works more efficiently the second time round. It is then able to thin, soften, shorten, and open or dilate at the same time, which is typically why our second babies or third babies tend to come a little bit more quickly than with our first. So hopefully you can see my demonstration how this is going to work. So the uterine contractions in labour are actually going to start from the top of the uterus or the fundus. Typically the lady is going to feel these lower down, perhaps in the lower abdomen or her pelvis, or maybe radiating into her back and into her bottom, maybe even some sensations in her vagina. The uterine contraction is going to come and it's going to relax. And hopefully you can see that the cervix is starting to lose some length now as it's thinning and softening, shortening and effacing. But as this process is happening, we aren't actually achieving any more dilatation at this point because the piece of string process is still underway. As the cervix reaches the point of being fully effaced, then the body is going to start working more efficiently. And as we come to the end of the piece of string, you will probably feel that the contractions are coming in a more regular pattern and are lasting a little bit longer. Hopefully you can see that now the balloon or the uterus has reached the end of the piece of the string, there's no length left. It can now start opening or dilating more efficiently. So these contractions are going to keep on coming, are going to be much more regular and lasting a little bit longer as baby's head is coming nicely down onto the cervix. With a balloon, we're never going to achieve 10 centimeters dilatation, but it's giving you the idea of what's going to happen. And these contractions are going to keep on coming, and very soon we shall be having a ping pong baby. And just like that, our baby is born, okay? So hopefully that helps you to understand the piece of string process. And sometimes first-time mums find this piece of string a long and a frustrating process. And they may wish to come in and be reassured that all is okay, or they may just want to ring and have some advice and reassurance that this is very normal with your first baby.